Hi, sir. Good evening, sir.
Good evening, Dev. How are you?
Good, sir. How are you doing, sir?
Fine, thank you.
Sir.
Good evening, sir. Good evening, Dave.
Good
Good
evening.
evening, Pooja.
Good evening, Pooja.
Tell me when you are ready.
We'll start at 5 sharp. Ritu, 3 minutes to go.
Yes,
Yes,
Ritu,
sir. We'll start
हाँ,
at
हाँ,
5.
Just let me
Yeah,
know.
five more
let's
minutes.
3 more minutes.
Uh, yeah, like, please start the session.
Yes. Done. So, good evening, all the respected doctors and our colleagues. At the outset, I, Dev Tyagi, on behalf of Mankind Pharma Limited, welcome you all for this second module of National Diabetes Education course. And to speak upon the same, we have with us our course director, Dr. Prasanna Kumar sir. So I wish and hope that everybody is in a good state of health and taking all the precautionary measures out there, as the world is fighting with this pandemic. So without wasting much of time, I would request Dr. Prasanna sir to start the session with the scientific proceedings.
Thank you, Dev. Let me share the screen.
Yes, sir.
Good evening, everybody. Welcome for this second session. That is module 2. We had module 1, then this is module 2. Module 1 was introduction. Module 2 is non-pharmacological management of diabetes. Last time we discussed about what is diabetes definition and what is the prevalence and what is the incidence. And also we discussed that what are the symptoms, what is the classification. Once you diagnose, the most important thing is how do you start treatment? And in diabetes, first treatment is always non-pharmacological, that is lifestyle modification. This is my conflict of interest. This is my disclaimer. Now, in this module, what are we going to learn? We are going to discuss about diabetes. What is diabetes? It is diabetes and obesity. Nearly 40 to 50% of our patients today in urban area with diabetes are obese. What is the role of medical nutrition therapy in diabetes? What is medical nutrition therapy? What are the components? And as I told you, lifestyle changes like diet, activity, and behavioral changes. These are the most important things which we are going to discuss in today's module. These are all the very subtopics under which we are going to discuss. I hope to cover the whole thing in 40 minutes so that we have 20 minutes for discussion, because the most important thing is discussion. Whatever your opinion, questions, comments, and a lot of you have a lot of experience, so that I would like you to share your own experiences, opinion regarding the non-pharmacological treatment of type 2 diabetes. As you know, risk factors for diabetes are rapid urbanization, unhealthy diet, and sedentary lifestyle. So these three factors or risk factors should be corrected or should be addressed when we start treatment rather than just a pharmacotherapy as such. As I told you, diabetes is increasing. What is diabetes? Diabetes is combined detrimental health effects of obesity and diabetes. That's why it's called diabetes, obesity plus diabetes. Early detection of the effects of diabetes on the cardiovascular system would enable optimal implementation of effective therapy. By pharmacological method, you can control diabetes, but by lifestyle modification, you will also improve and reduce the cardiovascular risk, renal burden, general health will improve, and long-term mortality, morbidity will come down by lifestyle modification, not just by drug as such. Of course, obesity is something which is prevalent all over the world. United States has the highest amount of obesity. Nearly 40% of the population are obese. Again, in India, it is very heterogeneous. If you compare states like Kerala, Tamil Nadu, then you have got Andhra, and then go to Odisha and certain parts of Punjab, obesity is much more common in this area, as it has been studied by Verma and Das et al. Now, overweight and obesity are a risk for diabetes. What is the definition of overweight? You have got an ideal body weight. One of the very crude method of doing it is the BMI. Then, or even the rough one, if you take like that, height in centimeters minus 100 is what ideal body weight. Or you can say BMI. BMI 23 is normal for Indians. So 23 to 24 is overweight and 25 and above, meaning that 10% more than ideal body weight is overweight and 20% more than the ideal body weight is obesity. So whether you can do this height formula where it's height minus 100 is for men, height minus 102 is the ideal body weight for women. What are the adverse metabolic effects of overweight and obesity? All of you know that because of overweight and obesity, there will be hypercholesterolemia. More obese you are, there will be more fat. So fat is insulin resistance, and obesity is associated with triglyceride and blood pressure. As I always say, obesity is not a disease, but it is the mother of all diseases. Increase in BMI leads to steady increase in risk of coronary heart disease. So Lot of studies have shown obese people have more coronary risk disease compared to overweight, compared to normal weight. Again, type 2 diabetes itself has got more likely in obese patients. And ischemic strokes are also more common. So whether it is coronary artery disease, diabetes, ischemic strokes, obesity is one of the root cause for all these things. Let us take one case where Mr. AB is a retired 69-year gentleman with 5-year history of type 2. At the time of initial diagnosis, he was advised to lose weight, but no further action was taken. He didn't follow. All of you know intense lifestyle modification, weight loss can reverse diabetes. AB complaint of recent weight gain, suboptimal diabetes control, and food pain. He has been trying to lose weight and increase exercise for the past 6 months without any success. And he had been started on Liberate 2.5 mg every morning, but stopped because of dizziness, often accompanied by sweating and a feeling of mild agitation. He has also been on atorvastatin 10 mg for hypercholesterolemia. He has been on some supplements for diabetes control, but stopped since there was no result. What would be your next step in managing him? Of course, the management should be, you know that sulfonylurea should not be used in an obese patient, is not the first drug, metformin is the drug, and taking 2.5 is getting symptoms of hypoglycemia. That is the most important thing is the management strategy should be to see that he follows lifestyle modification. Complete history of the patient was taken, examination showed fasting, all these tests were done, and assessment was uncontrolled diabetes, obesity, hyperlipidemia, peripheral neuropathy, hypertension, elevated microalbumin, and most important strategy is self-management of diabetes, like lifestyle deficits if they're correct, and if there's poor understanding of diabetes, diabetes education is most important. So first step would be weight loss because this patient is obese. Diet consultation focusing on weight loss, improve diabetes control. Patient has to maintain a food diary logbook. Many times you can have 24-hour recall or 48 hours recall or weekly recall. Write down what all you're eating. When you look at the dairy dietitian, can look here, you are having breakfast which is heavy, lunch has a lot of carbohydrate, dinner has fat. So you can modify right change because only when you know the history, you can see whether it's vegetarian, non-vegetarian, has 2 meals or 1 breakfast, whatever it is, or in between snacks. Physical activity, they should walk 30 to 40 minutes each day, at least 5 days a week. The ADA and all suggest that you should have 150 minutes of exercise at an average of 30 minutes per day, 5 days a week. First line of medication targeted to improve the glucose control. Now, this is when you go through medical nutrition therapy. These are the questions what we come, whether a dietary approach to treating medical condition that can be followed at home, or an inpatient treatment hospital that specializes in nutrition, a line of vitamin mineral supplement, intravenous procedures, and to boost patient nutrition, and what is it and all. Most often we see that it's only an outpatient consultation regarding the nutrition therapy is sufficient. Now, medical nutrition therapy is a systematic approach to optimize dietary intake. First, basic take history. What is diet pattern? Tell them I make very few changes, which is acceptable. It's a sort of bargaining to the patient. If this is the diet, this is what lifestyle, sir, I agree, I will follow it. Otherwise, just handing over a diet, 800 calorie patient, never follow that. Achieve metabolic control, maximize favorable treatment outcomes. This is what we see in Indian scenario. Dietetic counseling and adherence of healthful calorie restricted diet, regular exercise linked to low rates of incident diabetes in Indian men as IGT, implementation of medical nutrition therapy based meals, and in rural urban population where the north, south, east, west showed a favorable changes in dietary pattern, improvement in BMI, waist circumference, and blood sugar. A stepwise diabetes prevention program reduces 3 years of diabetes by 32%. Suppose somebody is taking 3,000 calories, reduce to 2,500, 2,000, 1,500, 1,200 calories. So by reducing 20-30% of the calorie intake in 3 years, they can reduce the risk of diabetes by 32% in obese Asian Indians with any form of pre-diabetes. Pre-diabetes is HbA1c 5.8 to 6.4, where you can even reverse it as such. There is what is known as a look ahead a landmark lifestyle intervention program which assessed the effects of calorie-restricted diet, reduced intake of high carbohydrate, on glycemic control and prevention of cardiovascular complications. At 11 years, in this look-ahead trial, participants benefited from the regimen of diet, average weight loss of 5%, substantial improvement in A1C, blood pressure, lipid profile, overall fitness, well-being was noticed in this look-ahead trial as such. This is a randomized trial on medical nutrition therapy in Indian patients in a year-long prospective randomized study from India. Patients with type 2 were randomized to MNT. They achieved significant lowering of A1C and all lipid parameters. Study reported success of individualized medical nutrition therapy versus usual diabetes care. As you know, American Diabetic Association, IDF, American Association of Clinical Endocrinologists, as well as our own RSHA recommend medical nutrition therapy as first-line therapy, provide consistent recommendations for day-to-day nutrition requirements, and consider when you give a diet chart or diet advice, regional, cultural, economic, agricultural factors for individual MN therapy. Agricultural, why? Because what is grown there, you cannot ask them to get something from abroad and use it. So it should be regional, cultural, economic, and agricultural factors, which takes into account all these factors, and a diet chart advice which is acceptable, affordable, and adaptable by the patient, very important. Now, medical nutrition therapy in prevention management, it has got 4 components. As you know, all the diet has got carbohydrate, protein, fat, and diet pattern as such. Medical nutrition therapy, there is nothing like one size fits all. Eating pattern is different, cultural, social, economic, behavior is different. That's why MNT should be individualized and it should be specific to the individual. No single ideal dietary distribution of calorie among carbohydrate, fat, proteins for people. Individual meal plan, variety of eating pattern. Sometimes patient says, oh, I know from my neighbor, my aunt has got a diet chart, I'll follow that. No. Please go to dietitian, a qualified, competent, and experienced dietitian will take your habits, height, weight, accordingly she'll give a diet chart. What is important in diabetes is small frequent meals. Many people are used to 2 large meals, one lunch at 10 o'clock, another dinner at 7 o'clock, which is not good. Have a light breakfast, light lunch, and light dinner. If necessary, you can give 3 small snacks post-meal, post-lunch, and at bedtime a glass of milk like that. So everything should be small portions of such. Lot of people use lot of different methods to follow this. All of you must have heard about intermittent fasting, and every religion has fasting, whether it is 1 day fasting, 15 days, once a month, once a week, or 4 weeks, 6 weeks in a year, or it may be some part of the year or day they can. And also, a lot of people have food fads, and these food fads are for diets as such are short-lived. They do something and then stop. I know some people alternated, they fast for 3 months or 6 months. What is most important is look at macronutrients and micronutrients. Carbohydrate can form 50 to 7%, protein 30%, and fats roughly 10%. Shashank Joshi and others have done a study all over India. They find on an average 60 to 65% of the diet in India contains carbohydrate, but our protein is very, very poor all over the country. So meal composition, when you advise meal, it should be low glycemic food, low carbohydrate food. I will explain what is glycemic index, high monounsaturated fatty acid, high protein content, the energy deficit. As I told you, whatever diet they are taking, it should be 30% less than what they were taking before this. So that ultimately you will see that the average daily intake is about 22 calories per kg per day. That is the average intake. If you reduce for 20-30%, patient will lose weight. As I said, whenever you take food, take a small plate. If you use a large plate and you try to fill it up, you tend to eat more. That's why smaller cutlery, smaller spoons, or 6 inches diameter plate is better than 10 to 12 inch diameter. Prepare bread such as chapati or naan with 3 inch radius. Don't make big chapati. Oh, because I have taken this, not waste, they will eat. Serve curries in 3 inch diameter bowls. Serve vegetable in 3 finger bed size. And glasses should be only to a height of 3 inches while taking any calorie-rich beverages. Most important thing is many people follow carb counting. That means you count the carbohydrate. Suppose you take one chapati, how much of carbohydrate it contains. Then you know exchanges, whether it is food exchange like cereal is exchanged for fruit or cereal is exchanged for vegetables. Experience-based estimation measurement of glycemic index. Assess physiological effects of high carbohydrate diet as such. Then these are the high carbohydrate, low fat diet, HCLF, otherwise it's called. Replace high glycemic index carbohydrate with fiber-rich, low glycemic index counterpart. Replace white rice with brown rice. Fortification of Indian dishes with fiber-rich alternative. Add wheat flour with soluble viscous fibers and viscous fibers and legume flour. Sugar and sweetened beverages increase the glycemic index as such. Consumption of sweet, sweetened beverages, additional sugars have customary and regional import. Many times, when South Indian cooking, they put lot of jaggery. So that food is tasty, but that is hidden sugar. They will not know that jaggery has been added to food. That is why one should be aware of these things at all. Then there is low carbohydrate diet. You must have heard about low carbohydrate diet. It can be 20%, 30%, and sometimes they have gone up to 20 to 30 grams of carbohydrate per day. This is known as ketogenic diet because when the carbohydrate is less, fat is more, then when fat is utilized, ketones are produced. Obese type 2 diabetes may switch to low carbohydrate ketogenic diet based on calorie restriction, regular intake of fats, and low calorie diet. This is what I was trying to tell you, glycemic index. If you take a blood sugar concentration here and you give 50 grams of glucose solution, if you look at it, this is how area under the curve, and this glycemic index is taken. When you take 50 gram glucose, area under the curve over a period of 2 hours is called glycemic index 100. Compare that to sugar, which is sucrose, 50 grams if we take, it is 62% area under the curve compared to the red curve. If we take fructose, which is available in fruits, if we take 50 grams of fructose, area under the curve glycemic index is 90, meaning that the fruits have got less glycemic index compared to sugar, which has less glycemic index compared to glucose. So whenever your patient takes diet, you should see that what is the glycemic index. If the glycemic index is more than 70, it is called high glycemic index. 56 to 69 is called medium glycemic index. And if a food has less than 55 like this, then it is called low glycemic index food. So the effect of blood glucose from a high versus low glycemic, as you say high glycemic, where it is, you'll see that, and this is a low glycemic index food as such. Now, what is the mechanism? When you take food consuming high glycemic index food and they feel more hungry, blood sugar goes up, faster glycemic, quick release of glucose, and you feel hungry early. Whereas if you take food which are in low glycemic index, fruits and vegetables, blood glucose molecules get absorbed slowly, gastric emptying slow, because when you take food like protein, fiber, vegetables, slower release in bloodstream and attenuated response, so keeps you full for longer time and blood sugar rises slower. That is why you should always advise low glycemic index food. This is one chart where all of you can go through that, where you see grains and starches. What is the glycemic index? You look at white bread here, it is 100. Look at vegetable, most of them have 15 except the chickpeas and cooked carrots and all. Look at fruits, again they have got a low glycemic index, lot of fiber, and dairy products here, and proteins also low. That is how, whenever you see, look at the glycemic index, whether it is low, medium or high, you have to advise patient to take more of foods with a low glycemic index. Now, this is what I was telling you. Prefer brown rice, matha rice instead of white rice. Take steel cut oats instead of instant oatmeal. Use bran flax instead of corn flakes, and use barley instead of oats and pasta. Prefer whole grain bread instead of white bread, and prefer peas or leafy greens compared to the corn, and take naturally low glycemic index wheat flour and such things as such. This is what is a very important pyramid. What is this pyramid? The pyramid says how you take different types of food as such. This is what it is with low glycemic index, moderate glycemic index, and high glycemic index, like refined flours, fat, sugar, and other things. So you must consume foods which are in low glycemic index. So you can tell patients, show this pyramid and say, this is what you can use liberally, moderately, and sparingly. That's how I say. Then you have got a glycemic load. We told about glycemic index. Next word is glycemic load is a ranking system for carbohydrate content in a food portion based on the glycemic index and portion size. A food is a complex food. It contains carbohydrate, fat, and protein. You should see that the carbohydrate content is less, then glycemic load is less. So glycemic load for a single serving of a food can be calculated as the quantity in grams of its carbohydrate content multiplied by its glycemic index divided by 100. If you see pulses, pulse in corporate cereals have a less glycemic load. Meals with mixed source of cereal, pulse, and legumes contribute to regulation of insulin. Acaribos in regular daily diet and Adai dosa contains 75% and 25% cereal compared to a regular dosa, which contains the 75% of the cereals and 25% of the pulses. That's why you can prefer such things. And also, if you include nuts like almond, walnuts, cashew, pista, hazelnuts, and all, then you will see approximately 56 grams of nuts. Diet rich in rice and pulses. Legumes such as chickpeas substituted for similar serving of egg, baked potato, bread, and rice acids because chickpeas have a good content of protein acids. Oils, of course, you should replace refined cooking oil that is saturated fat to monounsaturated fatty acids like canola, olive oil. Of course, olive oil is expensive. We don't use much of it also for fried. Most often mustard oil in north, coconut oil in the western parts of it, and groundnut oil in South India is used. Then repeated heating and frying, because this is the worst thing. Sometimes they use oil and fry something, keep it again. When you repeatedly heat, it is quite bad. Don't use it. 3 tablespoons of cooking oil, butter or butter per person per day, that is 15 grams, gives about 135 calories. This is what maximum is. Best thing is to calculate. Suppose for your house with 4 people, you are getting 1 kg of oil. Reduce it to half kg per month because individually it may be difficult. Oh, this month 4 of us are going to use 500 ml of oil rather than 1 kg. So like that, if you calculate the whole consumption of oil in the house should be less. Pregnancy, lactations or convalescence up to 3 tablespoons. Each tablespoon is 15. That comes to 45 grams. Otherwise, 15 grams, that is 3 teaspoons for other persons. And because in this situation, you need to get about 405 calories, here only 135, 1/3 of it. Of course, fiber, increase the fiber content. And also in overweight, obese patient, low glycemic index, high fiber diet reduces glucose and insulin. Use high carbohydrate, low glycemic index diet with high proportion of fibers. And when you say fiber, you should have both soluble and insoluble fiber. It is available as well. Salt intake should be less than 5 grams. Most of the Indian diet contains 15 to 30 grams of sodium chloride per day. Every food, whether it is pickle, papad, rasam, sambar, there is no food of ours which does not contain the salt. As such, our food is very rich in salt. We, as I said, take 15 to 30 grams of salt. We should try to reduce the salt intake in our food because this is, as I told you, Indian practice of adding salt at dining table also should be avoided because whatever is put for cooking, all right, don't put extra salt. This is another way where you can avoid taking it. Of course, these are all the spices, seasoning, what you use and others. These are salt substitute as such. Non-nutritive sweetener. A lot of people ask, may reduce overall calories, carbohydrate intake is substituted for caloric sweetener. So I've got a sweet tooth. I want to have a sweet. Then a lot of foods are prepared and which are available where non-nutritive sweeteners are available, especially aspartame is the one. And this is the one which is better than what we used to have in the past, which gave a bitter taste. Aspartame or some of the others which are available don't have much of bitter taste. Low calorie, non-nutrient sweetened beverage as a short-term replacement. It is not good to take a lot of these artificial sweeteners. People get into that addiction, take a lot, and it's not good to take most of them. Overall, encourage to reduce both sweetened, non-nutritive sweetened beverage and use other alternate. This is what most of us have been knowing for the last so many years, what is known as DASH diet. What is DASH diet? Dietary approach to stop hypertension. This diet is more useful in hypertension, has been clinically shown to reduce high blood pressure levels in moderately hypertensive patients. Which of the following is not accurate? Increase intake of fruit and vegetable. No, we have to take, it's a part of DASH diet. Use of low-fat dairy product, reduce alcohol intake, and daily intake of 4 grams of sodium. Engage in regular aerobic activity. Of course, aerobic activity is not a part of the diet as such. This is what most of them have been telling about the Mediterranean diet. All of you know Mediterranean diet, the most healthy diet. Why people in the Mediterranean surrounding area live longer, less diseases. So this is what everyday physical activity. Then you have more of vegetables and fruits. Then you can have at least twice a week this fish and seafoods, and weekly moderate portion of poultry, egg, cheese, and yogurt, and less often meats and sweets. This is what a Mediterranean period. But what is relevant to our countries, I told you the previous one. This is the diet involving what to eat, whether amount of grains, fruits, organic dried fruits, lean meat, nuts, and vegetables. So meal planning should be like this. If you take a plate, non-starchy vegetables should form 50%, carbohydrate should be 25%, protein food should be 25%. Of course, water has a 0 calorie. So this is the diet, and all of you should know about direct trial. Direct trial involved 5,000 patient diabetic newly detected in Canada, in UK. This study was done under NHS, where 2,500 are given diet, usual diet, and exercise. Another 2,500 followed intense lifestyle modification. At the beginning, HbA1c was anywhere between 8 to 8.5. At the end of 1 year, 42% had reversal of diabetes. At the end of 2 years, 36% had reversal. What are the most important things? People who are diabetic within 5 years could reverse diabetes 1, and people who lost 15 kg of weight could reverse diabetes. People who are on insulin cannot reverse diabetes. These are the studies of direct trial, and even in India, many papers are shown to say how you can reverse diabetes within 5 years of onset. And in Indian setup, if you lose around 10 kg, you can definitely reverse diabetes initially. Moderate and intense physical activity improves insulin sensitivity, reduces abdominal fat in children and young adolescents. Exercise program to prevent diabetes are aerobic activity, resistance training, breaking up prolonged sedentary time. So exercise hierarchy is flexibility and balance, aerobic and resistance strength, where you build weight by that. So physical activity may be structured, minimum 30 minutes per day, 150 minutes per week. Resistance training is alone or combination with aerobic exercises or walking. And I told you 150 minutes per day. And the additional 60 minutes of activity is recommended in Asian Indians predisposed to develop type 2 or CBDs. So all the others advise 150 minutes. RSSD guidelines, ESI guidelines suggest that those who are at a risk for diabetes, heart disease, can have another 60 minutes, meaning that instead of 2.5 hours, you can have 3.5 hours or 4 hours per week is the exercise that is advised for Indians, which is better, because basically we are not that active person. Of all the countries in the world, India or even some countries in Asia, we are very, very lethargic as such. Our activity in a day-to-day normal person is much less compared to the Caucasian, European, and other races. Now, medical nutrition therapy of a woman from pregnancy to delivery. Now, there is a Mrs. F, 52-year-old widow, diagnosed with diabetes last year. Patient has moderate physical activity, walking, and household. Currently, patient has a loss of appetite, brought to hospital, conscious febrile, experiencing vomiting, dizziness, admitted to hospital with a chief complaint of severe dizziness. Her fasting blood sugar 142, blood urea 89, hypertension 140/90, diagnosed with diabetes with uncontrolled hypokalemia. So in such situations, health and nutritional data and treatment are important. As I told you, in pregnancy and lactation, dose restrict the calories. If a woman is supposed to take 2,000 to 2,500, let her take it. Don't restrict calories, because If the mother has malnutrition, the child will have later problems. So pregnancy is one place where you cannot. After delivery, she can go on a diet. She should not take low calorie, low carbohydrate. You should match insulin to diet rather than reducing the diet. So health and nutrition data shows frequent skip breakfast and lunch, only eats afternoon and snack and dinner, seldom eat outside, lower water intake but drinks caffeinated beverages such as coffee, poor food intake, and eats when hungry. The macronutrients should be low fat, low carbohydrate. Very important micronutrients should be high potassium diet, low sodium diet. Indian diet as such has got a high potassium. This patient, what we are referring to, had uncontrolled hypokalemia because her protein intake was less. So, potassium intake was less, so high potassium intake. And of course, low sodium diet is necessary. Increase fluid intake because they take less of water and other things. And started on human biphasic insulin. And of course, the drugs like telmisartan. If there is hyperkalemia, high potassium, you should not use telmisartan. In hypokalemia, you can use telmisartan or losartan. And K-Lite. K-Lite gives the potassium because this lady had a low potassium. Amlodipine for blood pressure control and other continuous monitoring after discharge to prevent hyperglycemia. Lifestyle behavioral changes for diabetes prevention. Intense lifestyle behavioral change. As I told you, direct study where you can see 10 to 15 kg of weight loss, reversal of diabetes. Achieve, maintain 75 loss of initial body weight and increase moderate intense physical activity to at least 150 minutes per week. Variety of eating patterns can be considered. Technology assisted diabetes prevention. There are a lot of apps where patient daily records. Now we have got this Fitbit, how much of exercise. Some people do 5,000, some 10,000 steps per day. That is recorded. And every diet or breakfast, lunch and dinner is also recorded, sent to a dietitian, she'll give advice. So behavioral lifestyle intervention, like counseling for strategies such as tailoring goals, self-monitoring, stimulus control, involves monitoring carbohydrate intake and setting targets of weight loss. Everybody asks about alcohol. Yes, drink in moderation. Anything in excess is bad for diabetes. Excess of intake of food, even excess of alcohol, everything is bad. No more than a drink per day for an adult woman. No more than 2 drinks per day for adult men. I don't advise every day 2 drinks, though ED and all says. I always tell them 2 pegs twice a week maximum. If we say twice a day, you'll make it 3 times. If we say daily 2 drinks, you'll make it 4. So that's why I always suggest 2 drinks twice a week. That too social drinking. Don't drink when you are alone. Then you tend to drink more. Nobody will calculate how many drinks he has taken. When somebody else is their friend also, and they will usually tell him, okay, had this, it is more. Glucose monitoring after drinking alcohol. Many times people say, sir, on the day I take alcohol, I don't take tablets. I don't know why it has gone in the mind of many people. If I take alcohol, I should not take tablets. These are all old theories where the previous drugs of generation, they used to have a flushing. When they took sulfonylurea and alcohol, they thought it is bad or something like that. So please tell them 1, not more than 2 drinks twice a day. And when you take alcohol, that itself gives calorie. Eat less. Some people have drink and then have a heavy dinner. It is quite bad. Never miss your tablet. And on the day you drink alcohol, 2 hours later, check blood sugar. Suppose it is very high. What does it mean? Your alcohol intake is bad. Sugar has crossed 200, 250 like that. Smoking. Unlike alcohol, you cannot allow any smoking. Advise stop smoking. Don't reduce. People who say I will reduce, will never do it. Stop smoking. Smoking cessation therapies provided under observation. There are a lot of things, nicotine patches and others. I don't believe in it. People who have a strong mind, yes, I will stop. People who say quit in stepwise and all will never do it. They reduce, again they go back. These are some of the things, as I said, I didn't want to take long. I have taken just exactly 35 minutes. We have 20-25 minutes where for question answer, because all of you have a lot of questions about the nutrition therapy. I would like to have your opinion, comments about the nutrition therapy. You can put it in the chat box. You can unmute yourself and ask the question. I'll be happy to answer to the best of my ability.
Thank you so much, sir, for giving us so much of insights about non-pharmacological management of diabetes. So we have few of the questions now. We'll be taking them. Uh, First question is from Dr. Yadva Kumar. What happens? My age is 62 years, and what happens if I take one meal per day since 25 to 35 years, but I'm not diabetic or hypertensive? Is it leads to any problem for me?
Definitely not, Dr. Kumar, because usually, see, every person is different. By and large, when we take food, the human beings as such, every 8 hours we need food. That's why all over the world you have breakfast, lunch, and dinner. As I said, traditionally, if you see your great grandfathers and all, they had only two meals. One meal at 10 o'clock, agriculture based, they used to go to fields, come back at 6 o'clock when the sun sets, have another meal. Only for children, pregnant women, they had breakfast and all. Britishers brought this for us, breakfast. The term breakfast was not there before that at all. They brought this evening tea and also from breakfast, lunch, dinner, evening snack and all these stuff. If you are comfortable with one meal and you are not very underweight and you have all nutrition in that meal, there's no problem at all. So, but it is better you have one more snack because a lot of people say if you have only one meal per day and if you get acidity and other things, this is what people say because stomach continues to produce that. A lot of people acidity and other problems. If you have no problem, you are taking one meal per day, you are healthy, absolutely no problem. I know there are many religious people who have one meal at 12 o'clock in the afternoon. They have been living years together here in Karnataka, and whatever they have, one meal at 12 o'clock. After that, they don't eat anything at all except water. They don't drink anything. They don't eat anything. I've seen them 60, 70 years. They are all Swamijis doing very well. And they are healthy also. So that's why it all depends. But the macronutrients, the fiber, everything good is in your one meal, absolutely no problem. This is what a lot of people are following, called intermittent fasting. What they do, they take food only within that 6 hours. Whatever you take, let us say between morning 10 o'clock to 4 o'clock. After 4 o'clock till the next 10 o'clock, they don't take anything. They may have 2 or 3 these 6 hours. Or you having only one meal in that 6 hours and you don't eat anything. If you have no problem, 62 years, healthy, no hypertension, diabetes, why should you change your habit? In fact, food is the worst addiction. More people die due to food addiction than alcohol and smoking. And your mindset is so strong that you are able to manage with one meal. I don't think medically that is. I remember my mother at the age of 93 used to have only one meal. And she was quite healthy, 32 kg. If they were to be 80, 90 kg, I don't think she would have been healthy and walking, talking without support and with all that. So I don't think medically there is any problem as long as you don't have disease.
Thank you so much, sir. The next question is, can pre-diabetes can be treated with lifestyle modification and exercise, diet and exercise, or we should start with the metformin?
Very good question. Who has asked this question?
Dr. Prashant.
Yeah, Dr. Prashant, this is a very good question. Look at all the guidelines in the world. ADA, ACE, RS, every guideline says when the HbA1c is 6.5 and above, you diagnose what is the first treatment, metformin and lifestyle modification. This is what everybody advises, all the guidelines in the world. 40 years back, when I was a medical student, then postgraduate MD, we were taught when a patient comes, those days we are not doing HbA1c, we are doing fasting, postprandial, GTT. Then the diagnosis of diabetes was fasting was 140, 2 hours after glucose more than 200. From 140 now it has come to 126. Then we were taught you can try 6 weeks to 3 months diet and exercise weight loss. We did not say start medicine at all. We were giving patients 6 weeks, sometimes even 12 weeks. And if they are good, given 6 months also. Lot of patients used to control diabetes and then say doctor, and we were doing fasting and postponement. But unfortunately today all the guidelines say you should use metformin irrespective of whatever it is from day one with lifestyle modification metformin. I still believe, I'm sure there are some patient of yours who come and say, sorry doctor, I want to try diet exercise. What is wrong? All right, his HbA1c may be 6.5, 7, 7.5, 8. And At the end of 3 months or 6 months, it comes A1C 6.4. What is your objection to it? I spoke about reversal of diabetes 2 years back in a forum somewhere in Gujarat. I said, any question? One physician walked in. He said, Prasanna, I have listened to your talk. 6 years back, my HbA1c was 8.3. I was diagnosed diabetes. And I am a physician practicing 30 years. I said, I will not take medicine. I tried diet, exercise. I lost 10 kg. Now HbA1c is 6.9. Last 6 years, I have not taken any medicine. All these on the assumption diabetes is a progressive disease. Whatever you do after 3 months, 6 months, diet fails, you need 1 tablet, 2 tablets, 3 tablets. It is not true universally. What the textbook writes guidelines may not be true. Like you said, some patients have maintained. I had my own doctor friend for 6 years. She was only on diet. Last week, one of my colleagues said, Prasanna, write on reversal of diabetes, scientific point of view, 5 pages, my book. And I'm going to write a book, how lifestyle modification and other things is reversing diabetes. And I'm a lady who have lost 12 kgs and I have reversed my diabetes. And even direct studies say they did not start on any metformin or anything. So science will change. As you said, if a patient says, or if you are also convinced, I will not, because once you start medicine and diet, say, sir, let me take 2 tablets. Why should I follow diet exercise? Tablet is continuing. It is simpler, better, easier that I eat whatever I want. He will never follow it. Whereas if a person follows diet exercise 3 months, HbA1c is controlled, he will do it lifelong and his diabetes may not progress. There may not be degeneration of beta cell. It will improve his cardiac, renal, everything. And if he loses weight, yes. Otherwise, it's not going to help. I personally feel what you said is correct. Many times patients ask me, I don't want to start. I said, guidelines is that. But if you think without even metformin, you want to try 3 weeks, 6 weeks, 12 weeks, please go ahead. Sometimes they come back, 7.58 becomes 6.6, good. And many times, a patient comes back after 3 months, what was 7.4 becomes 8.4. Then I said, look here, I had given diet chart, I have done exercise. You might have done it, but the disease has progressed. Let me start medication. Nothing bad will happen in 3 months, even if it has failed. But you continue diet, I'm going to add tablet. This is my approach. I will definitely give my patient time for diet exercise without medication if he prefers that and see what happens. But there are patients who cannot follow. Sir, as it is, I'm eating less. I am thin. So I don't think diet works. Better start medicine in such patients.
Right, sir. Thank you so much, sir. And the next question we have from Dr. Ranjit, it's like any difference in glycemic index of food items cooked using wood and gas fuel?
No, it doesn't matter because the glycemic index of a food will not change whether you steam it, cook it, whether it is on gas, whether it is on kerosene, whether it is on wood. So glycemic index of a food will not change. The only thing is temperature of certain foods, like vitamin C. If you add some of these things like lime and others, when it is more than 75, vitamin C get destroyed. But the glycemic index of the food will not change. How you cook it on wood or gas or electricity or steam is not going to change.
Right. Sir, next question we have from Dr. S. Venkatesh. Is long-term paleo diet advisable for weight reduction in diabetics?
Long-term
paleo diet advisable for
paleo
weight
diet.
reduction?
Yes, definitely you can do. Remember, as I told you, intermittent fasting or whatever it is, ultimately what I feel, you can't say intermittent fasting have a large weight. So if you follow this paleo diet and whatever diet, as long as the calorie content is less, this is the basis of all diet. You can't say you would add limit. Somebody takes 4,000 calories in 6 hours. There is no way that his weight is going to reduce. So what the direct trial has shown, they use 850 to 880 calories. Very difficult for us. Most of our diet is 1,200 to 2,000 calories, mind you. And in UK, they followed 850 to 880 calories. They had hardly 30 grams of carbohydrate. For Indian diet, very difficult. Ultimately, what matters is if the calorie content of any diet is less, 800 to 900, you can. Why not below 800? Suppose you take below 800 calorie, lot of fat is mobilized, you may get to ketosis. Lot of our friends had it. So paleo diet in the long term is good. As long as the calorie content is less than 1000, you can lose weight, maintain weight. If you increase the calorie, you will get back your weight. Very Dr. Vintu, this means.
Right. So thank you, sir. And the last question will take how effective this protein diet is during this pandemic, nutrition diet.
How?
Effective is the nutrition diet during this pandemic.
Yes,
What are your
it is effective. But the problem is not just the diet. The nutrition diet is good in pandemic. But what has happened because of anxiety? If you look at diabetics, lot of patients, they have worse become pandemic. They said, sir, I'm not doing exercise. That's why I put on weight. I've never seen HbA1c, which I see now, 12, 14, 16, 18, 20. So during pandemic, people are staying at home. They are not going to work. The parks are closed, gyms are closed. As a result, the physical activity is less. Then when you stay at home, food is also available. You have breakfast, you have lunch meager, you have dinner. When you are at home working 8 or 12 hours, you tend to eat more. Depression makes you eat more. That is why a lot of patients during this pandemic has worsened. But there are equal number of people who said, doctor, this is a chance for me. I could not do it before. During pandemic, I have lost 3-4 kgs. My HbA1c has improved a lot. So it all depends upon individual. You can't have a blanket statement. There are people whose diabetes has worsened. That is majority. There are minority of people who have followed medical nutrition therapy. They have lost weight and their diabetes is well controlled. That's a minority. Pandemic or no pandemic, how you face it is important. Some people sulk, they get depressed. Some people enjoy. I said, I don't have to waste 1 hour traveling to work. I did lot of exercise at home, cycling, skipping. I felt happy and I ate more of fruit and vegetable. A lot of time to get these things. That's why my health is better. How you take a situation is important. Like stress. Everybody has stress. Everybody has pandemic. In every distress, there is an opportunity. That's how we make use of pandemic, staying at home, whether you study more, you exercise more, eat less, healthy food, depends on that rather than blaming everything on the pandemic.
Yes, sir. Thank you so much, sir, for such an interactive session and giving us so much of insights on this topic, addressing all the queries. So we end this session here and we thank you for your time and thank you all for attending this session. And we'll meet up on the next module, that will be module 3rd. And the topic will be pharmacological management of diabetes.
Thank you. Bye all. Take care.
Thank you, sir. Have a great evening.
You too. Thank you.